This segment of Westlake Live is sponsored by the Blue Buffalo Company Natural Veterinary Diet.
90% of the information on veterinary nutrition online is incorrect. And also, if you're going to home cook for your pet, you look online for those diets, 95% of those were nutrition deficient. So there's something called balanceid.com. And for free, if you want to cook for your pet, they will devise the right amount of protein, the right amount of carb, and then they offer a supplement, which I've actually purchased for my own when I was cooking for mine, a vitamin mineral supplement. Because you just can't feed an all-meat diet. It leads to too many bone deformities. Let me just mention quickly food allergy, because we didn't talk about that. We talked about environmental allergy. Food allergy is present in dogs and cats, and unfortunately, there's no test for that. You know, if I think a dog is grass allergic, I can skin test or blood test that dog, just like it's done in you and me. But there's no blood or skin test that's valid for food allergy. Yet, there are blood tests offered at $300. Please don't spend your money on that, because all the testing we've done show that those are not valid at all. So how do you determine if your dog is food allergic? You have to use, and I'm going to emphasize this, a prescription hypoallergenic diet. Now, there's a lot of over-the-counter venison-only diets, rabbit-only diets, but those have all been DNA tested, and every one of them has other protein in them, such as beef, chicken. Well, the reason that we want to put your dog on a hypoallergenic diet, the definition is a protein that dog has never eaten, like rabbit, duck, venison, one single novel protein, and one carbohydrate. We don't want any other proteins in there because he's already been exposed to those. If you've been exposed to something, then you're allergic to it. If you've never been exposed, then you can't be allergic. So we're going to do this hypoallergenic prescription venison-only diet. Or there's something called a protein hydrolysate diet, where they take, say, soy protein and cut it up into little itty-bitty pieces so that when the dog is eating it, the gut doesn't recognize that protein, okay? Because it's so teeny tiny now. The gut only reacts to large-sized proteins, but we've cut that little one up, so then that protein goes right through and they're happily ever after. But none of those are sold over the counter. So you have to get with your vet to get either a Hills or Royal Canin. Blue Buffalo makes a hydrolyzed salmon diet, which my dog is on for allergies. So that's how you determine. You feed that for 8 to 10 weeks. If the dog gets better, it was food. And then you keep them on that.
You know, people probably would wonder, what is it like to be a veterinarian? What is a typical day or week like for you? Because you probably have many, many cases come in.
Well, it's different every minute. There's always a disaster or a perceived disaster, okay? Because let's face it, a cut around the face bleeds a lot, so that looks horrible. But I do have to mention that right now, veterinarians are the #1 professional for suicide. And I can tell you why that is. And I talked a little bit with Addie about this. You know, here's a 16-year-old dog that I'm seeing, and I've been seeing for 16 years. And these folks now are friends of mine, okay? I've seen them for 3 dogs, and this is their latest one. And that dog now has a terminal disease, and they've elected to put him to sleep because his quality of life is bad. So I'm doing that and crying just now thinking about it. And then my next patient is a new 8-week-old puppy. Well, I have to shut that off to go into that next room, because this owner of this 8-week-old puppy doesn't want to hear how horrible it was there, because she's all happy. This is our new puppy. This is Fluffy, and isn't he cute? And, yeah, he is. And so we are emotionally turning this off and turning this on, and then maybe getting home and the exhaustion factor and just literally losing it. And I think it's very hard to have a family and be a veterinarian. You know, when I was a pharmacist, that was a job. Veterinary medicine is my life. My life as a veterinarian was never the same from minute to minute. It was joyful, it was sad, it was so rewarding. The thing I miss so much about it is seeing the love that people have for their pets. And I think human medicine can learn a lot from veterinary medicine. So many times I've had people say to me, I wish you were my regular doctor.
Yeah.
Because I'll tell you something. The other day I went for my checkup, and I could have had lymphoma. All my lymph nodes could have been enlarged, but nobody checked that, okay? They listened to my heart for a couple seconds, but everything now is how you look on paper, or how it's important I get it into that laptop. When are they going to look at me?
I've had that experience, yes.
And so thankfully, veterinary medicine even though they try to emulate human medicine, which I think is a mistake, I still want it to be a one-on-one. And when I left practice, I could have sold my practice to a corporation and I wouldn't do it. I was by myself, sole practitioner. The buck stopped here. I was cleaning toilets. I was fixing the computer, doing all that behind the scenes. But that's because I wanted to do that. I wanted to have control over everything. Every receptionist that was nice to you was because we talked about that. Mm-hmm. And my employees were with me for 30 years. I was very lucky. We were like a family. Yeah, it's such a rewarding experience, and I think so highly of my profession. We're there to help. And I hate to say it, but I think human medicine has kind of lost that.
Okay.
And I hate to see our profession going that way.
No, I know. One more thing, just as an extension of your caring, but you do a lot of activism or volunteering.
Oh, I do.
So briefly tell us about that, because I know we have to wrap soon.
I just checked a puppy yesterday from, I volunteer with Golden Treasures, which there's GRIN, Golden Retrievers in Need, and Golden Treasures. Those are our two Northeast Ohio Golden Rescue Groups. I just checked a puppy, 10-week-old puppy male yesterday from the Amish, which she also took 4 breeding females. They didn't. So I volunteer with them. The APL calls me if they get a Durham case, Summit County Humane Society. And then when we're in Florida in the winter, we have the Clinic for Rehabilitation of Wildlife called CROW. So we rescue pelicans and tortoises and manatee. And so that's a whole nother division of veterinary medicine that I'm learning. I will tell you this, when I'm walking the beach in the morning and my husband gets the call, bring the net and bring the beach towel in the box, he knows there's a pelican that probably we get red tide down there, which red tide is a neurotoxin. And so they'll stumble around and, or the other thing, they get a lot of fishing line caught on them, which is horrible, and they swallow hooks. So when he gets that call, he knows to bring all that equipment. And we, take him in the car, take him and they treat everything for free. We need something like that here. Mm-hmm. But why I'm telling you this is they all carry lice. All pelicans carry lice. So you never want them in your back seat of your car. You want them in the box. When we take a pelican back to the beach, it's like parting of the Red Sea. What do you have? What is it? People are taking pictures and videoing it. And we walk through and we open that door and there goes the pelican. And it's just a thing of beauty.
And then one more quick thing that you're involved with is the China rescue.
Oh, thank you. China rescue dogs. Yes, dogs in China, unfortunately, are used in the meat market. Okay, they're raised for slaughter. And they have these slaughter trucks where they have cages of these dogs. And they have a Facebook group, China Rescue Dogs. Jill Stewart is the head of it. And Golden Treasures gets some Goldens. My little Gidget is 2 years old. She's from China. The CDC banned us from bringing those dogs into the U.S. last July because one of the rescue dogs from Iran came into this country with rabies. And I have to tell you, before we bring these dogs into the U.S., you have to have all your T's crossed and I's dotted. The paperwork is more than all of us put together for approval. So I'm not sure what happened there. They were looking at the vaccine, if it was a vaccine failure. But anyway, so they prevented us from doing that. So then we brought them in through Canada.
Oh, yeah.
And now they shut us down. So as of September 28th, we can bring them back here. The criteria is they have to have rabies titers done in China and show us proof of that. If that didn't happen, they have to be examined here by a USDA vet, given their rabies vaccine, and quarantined for 28 days. Wow. And let me tell you, this dog, I got Gidget at a year of age. She was living in a big gravel pit with all these dogs that, they do have a rescue there in China that takes them off these trucks. And she didn't know anything. Even now, like, that noise will scare her. But she's getting better. And it's just been so rewarding seeing her grow.
It's important information, and it's nice to know there's people who are so committed to helping animals. So on that note, thank you for joining us today. This was a wealth of information.
Thank you, Addie.
Thank you.
This segment has been brought to you by the Blue Buffalo Company Natural Veterinary Diet. Love them like family, feed them like family.
Thank you for watching Westlake Live Outside. Please subscribe to our YouTube channel and also support our sponsors. Thank you.